most famous physical therapist on the internet.
Hi folks, I'm Bob Short, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about the signs you should have an osteoporosis screening. So we're going to do this for both women and men, Matt. Now we're going to call you Matt. It's my son.
Yeah, well,
Brad.
Don't worry about it, Bob.
Okay.
It'll get better.
So we're going to go through for both genders,
Right.
women and men. And for women, they are at a higher risk. So you're going to find out that we're a little more stringent on them.
And we'll explain it. There's a very good reason for it. But Bob, wait.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Got to get our tongues moving here, Brad.
That's right.
You can also go to bobandbrad.com, go to the giveaway section, and this week we're giving away, you want to show, Brad?
Yeah, look at these nice, what do we call them?
ProPods.
Yeah, I really like it on my feet.
you put it on your feet.
I've got one down there. It really is a nice foot massage, and you can do balance. There's a lot of things.
Do mobilizations on it, too.
Yeah, that's right.
All right, you can also find it. It'll be pinned to the top of the page on Facebook. We'll even show you how to use it a little bit on there. Go to Twitter, Instagram, or TikTok if you want a 60-second version of the program. And also, if you are already listening to us on podcast, you know this, but nobody else does. We are now on podcast.
Yeah.
All right, let's get started,
What
Brad.
kind of thing was that to say?
I don't know.
Well, let's carry on. Let's find out about osteoporosis.
It's our first day of the week filming, and I got to get things moving here, the brain.
So osteoporosis, it's about bone density?
Bone density, but also, Brad, this is what I found out from Sarah Meek, an expert, is that the structure of the bone is just as important. So like the trabeculae and how they're put together is almost more important than if your bone is soft or not.
So because it's like, is that the outside of the bone?
No, the inside. Oh, it's like the engineering.
Oh, sure.
Does that make sense to you?
Yeah, the part of the bone that actually looks like a sponge.
Right,
cut through
exactly.
It.
And if that's designed to be strong, you're less likely to break bones than if you have, let's say, one that's designed weak, but you have strong bones. Does that make sense?
This is a genetic factor.
Yeah, okay. I think so. I don't know if there's much you can do that. Maybe Wolff's Law would work with that. That's meaning the more stress you put on the bone, the more that it reacts to it.
Right. Right. So your activity level.
Right. Right. All right. We'll have another video that we're going to show you exercises to do. So number one, all women who are over 65, you should have a screening. Just outright do it.
Right.
If you're postmenopausal women, 60 to 65, and you have one risk. So if you're over 60 and you're postmenopausal, and plus you had a fracture after age 45, you've had a hip fracture in a parent, because there's a
genetic component.
If you've abused tobacco, you smoke.
Oh, so that's going to increase your risk.
Right.
Okay.
Yeah.
Sure.
Always does.
Yeah.
Unfortunately, tobacco is bad with everything. If your BMI, your body mass index,
if you're a little heavier.
No. If you're lighter.
Lighter.
Yeah. If you're less than.
That's right, because your bones adapt to that weight, so they're stronger and heavier people.
Can you do the calculation for me, Brad? It's less than 22 kilograms.
What, in pounds?
Yeah.
Yeah, I can do that.
Yeah.
Where's my phone?
Yeah. All right. And E, extended. Oh, if you've been using like prednisone for like 3 months. I had a patient, Brad. She was in her 20s and she had really severe asthma and she had to be on prednisone. Yeah. We just take her for a walk. She'd break a bone. It was just, it was terrible. It actually ended up killing her. I mean,
yeah, I had a patient similar. She's in her 50s and she's on prednisone, and it really,
it's
a
hard
long story, but yeah, you don't want to get on that for too long.
Well, she would die without it. You know, she couldn't breathe. So, all right, number 3, if they found osteopenia, like when they did an X-ray on you, then you should have a screening for osteoporosis too, because that's the stage before osteoporosis.
So the X-rays will show signs of a bone weakening, becoming thinness. Yes.
Yeah. Hypogonadism. So that's a medical term that you know if you have it. Hyperparathyroidism. Same thing. if you had if you had a well, I'm sorry, I don't know, I can't read my writing on that one, Brad. So, here's the risk calculator. So some other things that could be giving you trouble, like if you have heavy alcohol use,
Mm-hmm.
2 or more drinks a day. If you're female, if you're white or Asian too, you're at higher risk.
Oh, really?
Did you know that?
No, this is statistically,
Hmm.
shown.
If you're black and Hispanic, you have lower risk.
Okay. They
And
don't know why. They just know the statistics.
Well, I think a
reveal
lot
this.
of the Asians, you see, they are fine boned.
Sure,
Would you say
later.
that? Yeah,
Well, yeah.
smaller as an overall rule of thumb.
Mm.
Would you? Okay. Here we go. I weight below 128 pounds.
Oh, so we
So-
have a number.
Yeah, we have a number. If you have kyphosis, now you on the podcast aren't going to be able to see this, but if you're bent forward and your spine is rounded out.
And kyphosis is the midsection of the back, right between the shoulder blades, and that area is rounded. And this is not uncommon with older people.
Yeah.
Um,
If you're really sedentary, that's not good either. You want to
Yep.
be moving,
Mhm.
and you just aren't doing any bone loading exercises.
Right.
Where you're at least walking and trying to put some.
Yep.
So, number 8, you have a physical disability, and if you're in a wheelchair, it's going to be, you're not getting bone loading.
Right.
like you-
It's
you
again
know.
an activity level and things
Right.
that are putting weight through your bones.
Too much caffeine.
Oh.
If you're drinking more than 2.5 cups a day. So you drink coffee? You don't, do you?
Yeah, I do now. I
Oh,
just
yeah.
started in the last year or so, but
You're not drinking that much.
well, 3 or 4 cups. No, I'm just kidding. I find that just in the morning, if I drink it after that, it doesn't taste good anymore, actually.
Sure.
So that's good. I'm glad I don't have to fight that off.
So low vitamin D, which we're in trouble for because during the winter we just don't get much of that sun.
Yeah,
So-
yeah. You tried the thing with the
Lights.
that one guy that goes out and freezes himself.
Oh,
and
yeah.
yeah,
Wim Hof.
yeah. Wim Hof.
Yeah.
But I'm not going to do that.
Yeah. Okay. Low calcium intake or absorption if you're not taking calcium in very well. If you're diabetic,
Mhm.
DM, if you've if believe it or not, if you haven't had any children, you're at a higher risk.
Oh, really?
So
Hmm.
they call it nulliparity. You're going to learn a new word. I think it's multiparity if you have multiple children.
Oh, really?
If you've was a big indicator. If you lost like over 1.5 inches of height,
Oh,
there's a reason for that. And since age 25, you should probably have it done. Although Sarah Meeks said that the numbers are all over the place, and she said 1.5 wasn't necessarily true, but you start thinking about it. That's for sure.
and if you don't know, Sarah Meeks is an
Yeah,
expert on it.
on it.
Spent not her whole life, but a great deal of her professional life dedicated to this topic.
Right. And the last one, if you do have what appears to be a spine deformity,
Mhm.
you're rounded out, you may have already had a compression fracture.
Sure.
Sarah called it silent fractures.
Oh, without
Um,
symptoms.
Yeah.
Mhm.
She said very common. In
Yeah.
fact, that was the most common fracture, actually, is silent fractures.
Interesting.
Yeah. All right. So, men, we haven't forgotten about you either. So, we'll talk about the men now. If you're over 70 for men, you're supposed to have it done, not 65 like women.
Okay.
If you're over 50 and you've had any of the following, then you should have it done. If you've had a non-traumatic fracture,
Mhm.
so you just fractured, like a hip fracture or a vertebrae or
So
wrist,
without a fall or
without a
obvious
fall.
reason, it just
Right.
got a fracture. Yeah. Mhm.
Same thing if they find osteopenia on an X-ray. They
Yep.
they-
Evidence of bone
Thinning,
not decay,
yes.
but thinning. Yes.
Same thing about prednisone use. If you've taken more than 5 milligrams a day for 3 months, you're at higher risk.
Now, I don't know if we cleared this up with the women. Maybe there's some men wondering, well, why do men in general have less chance? And it's because of going through menopause and the
I don't know what it all is, Brad. I think men tend to have bigger builds, maybe too, larger bones. I really don't know. I don't know. We need Sarah Meeks on that one to answer. Same as women, hypogonadism and hyperparathyroidism put you at high risk. And there's other risks that you have. again, if your parents had a history of a fracture,
Mhm.
it's interesting, isn't it?
So genetics.
Yep. If you've had the test in your femoral neck bone mineral density test, obviously you're higher risk for
So we're talking about the hip
yeah,
there.
yep,
Mhm.
yep.
That's where common fractures are in older
Heavy
people.
alcohol use. This is now for men. You can go up to 4 drinks a day.
And that's probably because of generally they're
Yeah,
larger,
right.
heavier, and more muscle mass possibly.
BMI less, or if they weigh less than 128 pounds,
They're more
a slighter build. If they've had prostate cancer and they had an orchiectomy,
Mhm.
remember from anatomy what that was?
Orchiectomy?
Yeah.
No, I did
Well,
not.
it's not what something you want when you're mad.
Okay.
You're losing something vital.
Oh,
Part of it.
say
anyway.
no more, Bob.
Yeah. Loss of height also in men, 2.4 inches since age 25 is the one I read.
Okay.
So, if you
I've lost about an inch.
I've lost
inch
about
so
an inch,
far.
I would say. And I had an inch to give. So,
Yeah, proportionally you're taller, so maybe you can go a little more than that. So you're really good, I figure.
yeah. Again, low calcium intake, low vitamin D intake. Again, we talked about that, the sun.
Right. So really, and those, if you're not in the sun, or you're just getting a good diet of leafy
Right.
greens and that kind of thing, you can do a little.
I do take the pill for vitamin
Sure.
D.
Yep.
Just during the winter.
Okay.
I take it. If you're diabetic, and again, if you have high caffeine intake, greater than 2.5,
Mhm.
the thing is, it can be treated to some extent. You can't reverse it, but you can certainly stop it from getting worse.
Sure.
And so it's better to know if you are osteoporotic, and they can put you on meds, or you can maybe become more active.
More active,
right?
Your diet, get out in the sun. It really kind of boils down to a lot of the common things as we get older. You got to clean up your act and
Yeah.
treat yourself like
And so finally, though, let's remember, Brad, we can fix just about anything
except for
a broken heart.
right. But by the time you're this age and you have this, you have a little more experience with it. Usually,
You know how to get
they don't
through
need
it.
as much help.
That's right.
I hope. I don't know. Whatever.
Take care.